diagnosing cranial strain patterns based on finger configuration. So everything takes place in the vault hold as you're working on a patient. As you can see, for the purpose of this video, we'll be using this configuration. So if it's physiologic, it's going to be named based on what the index fingers are doing, and if it's non-physiologic, it's going to be named based on what the pinky fingers are doing. So the physiologics include torsion, flexion, extension, and side bending rotation. The non-physiologics include a lateral strain, a vertical strain, and compression. Compression is not always considered non-physiologic, but I have seen it categorized as such, so I include it in that way for this video. Let's get started. So a right torsion. Notice that my right index finger is more superior, representing the right sphenoid. My left torsion, left index finger is more superior, representing the left sphenoid wing. For a flexion extension, flexion, extension. You just have to remember that the sphenoid is flexing forward. Side bending rotation, a left side bending rotation. Notice that on the right hand, the fingers come together. It's kind of hard to see, but they're coming together. And on the left hand, they're spreading apart. Ultimately, you end up with the left index finger in the more superior position. A right side bending rotation. My right hand index finger is more superior. The non-physiologics include, again, the lateral strain, the vertical strain, and the compression. So for a lateral strain, recall there are two parallel vertical axes. And so a lateral strain is also sometimes called a parallelogram or parallelogram head. So you'll have a left lateral strain. Notice that my pinkies are actually both moving to the left as my index fingers move to the right, and a right lateral strain. And notice that a right lateral strain, again, the pinkies are both moving to the right. Vertical strain is going to be superior, where like that, but so you can see rotating this way, so the pinkies are actually rotating more superiorly, and a inferior vertical strain, where the pinkies move inferiorly as the patient lies supine on the table. A compression is the last one. Recall there are two parallel transverse axes for this, but you won't feel much on the exam because theoretically everything has sort of compressed together. So that you'll have to look more clinically. The patient might say something about depression.